Vet Girl podcast is sponsored by Blue Buffalo, the makers of Blue Natural Veterinary Diet. Providing clinically proven therapeutic nutrition for over 95% of indications, our veterinary exclusive diets are backed by 34 published and peer-reviewed clinical studies and adhere to industry standards, including AAFCO feeding trials. Blue Natural Veterinary Diet provides the results your patients need with the natural ingredients your clients demand. Visit bluevetconnect.com to see how we have science in the bag. Hi, Vet Girl here today, and super excited to speak with Dr. Adam Rudinsky about all things nutrition. Today, we're actually going to be talking about overweight and obese dogs, which is an area of passion for me because I work with a lot of sled dogs that have a pretty normal body condition of 2 to 3 out of 9. So, Dr. Adam Rudinsky, thank you so much for joining us for today's Vet Girl podcast.
Thank you. It's great to be back with Vet Girl. Always a pleasure.
Thank you so much. We really appreciate it. All right, just so our audience knows a little bit about you, do you mind just telling us a little bit about who you are, where you trained, and what you do now?
Oh, of course, happy to. So like you mentioned, my name is Adam Rudinsky. I'm at Ohio State University's College of Veterinary Medicine and happily on the faculty there in the internal medicine service. So my main area of interest is gastrointestinal medicine and how it relates to nutrition. And through that, because in a very biased way, the gut is so vital to everything, I get into a lot of different areas like obesity with some of my colleagues here in those connections.
Awesome. Well, thank you so much for taking the time to join us today. I, again, wanted to talk about being overweight or having obese dogs. And just like their human counterparts, overweight and obese dogs are prone to several medical conditions we'd like to discuss. So we don't forget our feline friends. In cats, we know that obesity is a risk for diabetes mellitus. Is this relationship seen in dogs?
Yeah, so the relationship between obesity and diabetes mellitus is actually pretty well established in both dogs and cats. Now, there are some differences there, right? Like if we often think of kind of the analogy between cats and a type 2 diabetic where they may or may not be insulin dependent, that role of obesity causing insulin resistance and subsequent tax on the beta cells and progression of disease is a super, super vital, important part of how we look at how we manage feline diabetes mellitus. On the canine perspective, though, it has multifactorial importance too, right? So we know there's tons of factors that ultimately will lead to this dog becoming diabetic and that dog not becoming diabetic. And obesity is one in that complex. But when we hone in on obesity, we know that not only does the obesity once again cause insulin resistance, which makes the pancreas have to work harder, which subsequently can progress failure. It also, once they become a diabetic, makes it a lot harder for us to manage because we're also battling the obesity from an insulin resistance perspective there.
So oftentimes when we change the diet of a dog that does have diabetes, is that specific for a weight loss or is it to provide less carbohydrate?
Yeah, so there's actually quite a few different reasons why you would want to do a good, like, AHA nutritional history and then make some of those diabetic recommendations. So two of the points that you hit on are super important, right? The more enriched with especially simple carbohydrates in a diet, the more you're going to see their glucose really pop up after a meal, right? And the name of the game with the way we manage most of our diabetics is kind of almost a blunt force hammer kind of fit to diabetic management. So I don't really want major swings in glycemic control after meals. So what's going to make those swings, like you mentioned, that's going to be those simple carbohydrates. In addition, we do want to manage the animal's weight. We know that's a big factor in, like, again, going back to cats, getting them into diabetic remission, but it's also a factor in terms of easing our management strategy for these animals when we have our canine diabetics. And then the third thing you'll also see in those diets is oftentimes they have things like fiber enhancement to them. And part of the benefit of that is, satiety and other things like that. But also the fact that fiber slows how much and how quickly that food empties from the stomach, once again, kind of dampening that postprandial hyperglycemia.
Wonderful. Thank you so much. All right. The next thing I wanted to talk about is one of my favorite things, but we rarely see it. And as a criticalist, I love to see respiratory disease. So, what about obesity or that overweight state affecting respiratory disease? I don't get to say this very often, but I have had some patients that are so obese that I have to tell their owners that they have Pickwickian syndrome. And first of all, do you mind just explaining what that term is, where it comes from, and is Pickwickian syndrome a problem in dogs?
Yeah, so I think we both share this. Probably you like a different type of respiratory case than I like. I love that chronic cough versus anything as urgent as what you're dealing with in your practice. But across the board, obesity is a problem for respiratory disease. If you have respiratory disease and you are obese, it needs to be one of the primary things you're addressing with owners. In fact, every single respiratory case that I see, if that animal has a high body condition score, it's getting some sort of nutritional recommendation, exercise recommendation, what have you, based in a patient-centric approach to try to manage that because of that impact. Now, when we talk about that, there's all kinds of things we know happen with dogs when they're obese, right? Like that adipose tissue that sets up in the rib cage, in the mediastinal space around the heart, as well as intra-abdominally and on the body wall, fundamentally changes respiratory mechanics, right? And there's studies that document that the decreased tidal volume or residual capacity in the lungs are all affected by obesity. So we know as you become obese, you're taking a tax in terms of how well your lungs are able to work. And then you're changing whether you increase the risk of decreased oxygen and increased carbon dioxide in the blood in the more severe phenotypes of that. Now, when we get into like Pickwickian syndrome, I think that's one of those things that we learn about in vet school, and it's like this really cool syndrome. So I feel like every veterinarian knows the name of Pickwickian syndrome, but then you have a whole spectrum of how much we actually know about the details of it. And I like that a lot of veterinary focus is now changing towards calling it obesity hypoventilation syndrome. And I think that kind of describes it much more succinctly in a way to really tell us what's going on, right? And it's that hypoventilatory state that obesity induces. And, I think your question, and I'd be interested in your opinion on it as well. I honestly don't know how often I see Pickwickian syndrome in my like awake everyday dogs, but there's more and more information coming out on sleep apnea phenotypes, right? And it is probably best recognized in the veterinary arena in anesthetized animals, where that hypoventilation is kind of noted and seen in correlation with those obese patients.
Excellent information. I will say a lot of vets don't know the term Pickwickian syndrome. And if you don't, you have to give a huge shout out to Charles Dickens, who wrote about it in 1836 in his book, The Posthumous Papers of the Pickwick Club. And I remember my old mentor from decades ago at University of Pennsylvania saying, "Oh, this dog has Pickwickian syndrome." And I was like, "What the heck is that?" She's like, "You don't read Charles Dickens?" I was like, "No." So anyway, that's where the origin of it came from. But you're right. It's now more commonly called obesity hypoventilation syndrome. Do I see it? Very rarely. I would say I've had probably two patients in 20 to 30 years where they were so obese that I did suspect that they did have it.
Yeah.
And it was truly that alveolar hypoventilation because the patient was so obese, and it led to secondary hypercapnia where their PCO2 was really elevated. And of course, if they have underlying chronic disease, which I hate treating respiratory wise, that you love treating, like, underlying, of course, we don't commonly see this in veterinary medicine, but like sleep apnea or,
Mhm.
chronic bronchitis, things like that, it's only exacerbated. So I would say very, very rarely, but those are usually the patients that are 10 out of 9 or
Yeah.
9 out of 9 in body condition score. So again, not super common, but something we do have to educate pet owners on because we've all seen those dogs and cats that can be that obese.
Yeah. And I think one of the things that's really interesting that came out maybe a year or two ago, roughly at least, were the brachycephalic airway syndrome dogs that had obstructive sleep apnea. And we're talking like small case reports. I couldn't actually tell you the true numbers, but they were treated with ondansetron, and that's a whole different conversation of mechanism and those sorts of things. But I do wonder whether it's analogous to how the work from the group at Missouri kind of bringing aerodigestive disease to the forefront of, and then now we recognize it on such a higher frequency, whether this is something that with things like this Vet Girl podcast, like bringing attention to it, is this something maybe with more focus we will see more often, particularly with the increasing frequency of obesity in animals?
I'm not going to lie, when I see a Boas dog, like a French bulldog, and in full disclosure, I have a Boas dog that was a rescue parvo, a surrender, and I let all pets sleep in my bedroom. This dog sleeps in the living room in a crate because I can't handle the snoring. I don't want to hear any upper airway disease. So I do believe there's a component of sleep apnea probably in these breeds. And of course, these breeds also have the compounded issues with IVDD, right? The
Mm-hmm.
higher
Yeah.
prevalence over dachshunds. So again, it just reiterates how important it is for us to talk to pet owners about making sure we maintain that good, ideal body condition score. Now, I did want to ask you something that seems totally different. A lot of pet owners wouldn't even think about this, but is there a risk for cancer in overweight dogs? I think there is some evidence with certain types of neoplasia in human medicine, but any evidence in veterinary medicine in dogs?
Yeah, I think that's a good point. And certainly there's always something, just full disclosure, that could be outside of the purview of what I know. Most of the evidence we have right now is extrapolated from the human side, where there's a really good link between adiposity and a pro-inflammatory state, and ultimately what that means across the board, right? Even some of the other diseases, like we're talking about in terms of diabetes at the very beginning of our discussion, is a link between obesity, inflammation, and diabetes. But when you think of both genetic and epigenetic control and factors that ultimately lead to the development of neoplasia, or at least in the milieu of multifactorial reasons that an animal develops a neoplastic process, inflammation is identified as one of the most commonly recognized factors there, right? So I think where we're at on the veterinary side is largely we know adiposity begets inflammation, which then leads to other complications. And we know that inflammation can be pro-oncogenic in that way. So, do we have like those super large studies showing a direct causality or anything like that? Unfortunately, we don't, but we do have association data, and we do have that mechanistic information with some links between a cancer risk and the state of chronic obesity.
You know, it's so interesting in talking to a few of my human medicine colleagues. Their biggest concern is metabolic disease as one of the
Mhm.
number one issues that we see as a result of obesity, as a result of that secondary inflammation. So again, so important that we be aware of that, which leads me to my next point. Is there a link between white adipose tissue and inflammatory disease?
Yeah, so I guess that gets back into the kind of core of that concept of inflammation and what else is going on with what happens in that obese state. So if we think of like you got brown adipose tissue, you got white adipose tissue, both of them have that thermal kind of component to it, thermogenesis focus. But white adipose tissue, which is kind of the adipose tissue we definitely don't like in ourselves at all times, is the side that also is the energy storage, which that's the problem in terms of the kind of vanity side of obesity. But it also really, a lot of endocrinologists would consider adipose tissue an endocrine organ, right? It is a major player in secretory endocrine physiology in the body, right? And lots of those are hormones that we're quite familiar with in vet med, leptin, adiponectin, etc., and how that affects the body in different ways. But so with white adipose tissue, as that grows, not only do you have direct pro-inflammatory components from that, but angiogenesis throughout white adipose tissue actually changes as you get higher and higher density, subsequently kind of sparking this cycle of inflammation in the body, which can then self-propagate and upregulate. And what you have is when you get excess amounts of white adipose tissue in the body, you essentially are now in an inflammatory state. And it's not going to be like, oh, hey, I come in and I'm like Cersei in the hospital, right? But it is this low grade inflammation that goes unchecked, kind of like those silent killers we think of in veterinary medicine or human medicine.
Thank you so much for bringing that up. And for those of you guys who don't know what SIRS is, and of course, we always use it as a verb, SIRSy, it's systemic inflammatory response syndrome. And for those of you guys who have PTSD, thinking back of our COVID days, that was part of the issue of COVID is that it caused this massive SIRS response. And I agree, it's not the severity of SIRS that we're seeing with obesity, but there's definitely a pro-inflammatory component that we really have to be worried about. And I'm talking about in humans too. Obviously, Adam and I are not human MDs, but as veterinarians, we do have to be cognizant. We know there's a definitive link between obesity and inflammatory disease. Now, I wanted to turn it around to renal when it comes to urinary tract disease. I will say in my general population of cats that I see with feline urethral obstruction, it's usually that young 2-year-old male neutered obese cat that's indoor that I see blocking. Is there evidence in dogs, like is urinary tract disease, including the risk of urolithiasis, more common in overweight or obese dogs?
Yeah, so I think there's a couple areas where we have that information a little bit more, at least underway in terms of our investigation. So the things I would say are the two areas that are most well described right now are actually urolithiasis, like you asked about, as well as urinary tract infections. So once again, I think if I would to say, what do most people in our profession think of in terms of risks, it would be those dogs that have external genitalia conformation, like a recessed vulva, that then you add adiposity on top of that, which conformationally makes the area more prone to perivulvar dermatitis and other things like that, that may subsequently make that animal more susceptible to a urinary tract infection. So I think that link between infectious urinary tract disease and obesity is pretty well established and recognized in our patients. But the internal medicine group up at Minnesota actually has been doing some pretty interesting research on urolithiasis in relation to calcium oxalate. And according to their paper, why they got involved in that research was we know now that 50% of animals in the US are going to be obese or overweight at least. And that's actually now pretty much across the world. Most countries where there's been those epidemiologic studies that documents it. And that's a massive increase over the last 30, 40 years in terms of the proportion of dogs and cats that are obese in our region here. And that actually has paralleled an increase in obesity in people as well. And in both of those populations, that has paralleled an increase in things like calcium oxalate urolithiasis. So they did do an initial study that looked and said, okay, there is an association, not necessarily causality, but there's an association between heavier dogs and development of urolithiasis, specifically calcium oxalate urolithiasis. And one of the syndromes that you talked about earlier, which is that metabolic syndrome, right? Like dyslipidemia, hypertension, obesity, and so on in terms of the human definition or the definition that's applied in veterinary medicine. And specifically, the dyslipidemia is what has been linked most closely on the human side to obesity and the development of different urine metabolites that ultimately cause that risk of stone formation. And the much more recent work out of that Minnesota group has further shown that as your triglycerides get out of control, meaning elevated, sorry, I shouldn't be so dramatic with out of control, but how as it increases by a set number, you actually increase your risk of developing urinary stones, right? And it's interesting, even just in the few minutes we've been talking, right? Like we're jumping from these different organ systems and other things like that. And it's so clear how this is such a central problem to so many things that we're dealing with in practice. But yes, to urinary system side, those would be two areas I'm aware of. There's a link.
I'm glad you brought up all that evidence. Love what they're doing at the Urolith lab with Dr. Lulich and that whole team there. I will say just basically on the floor, especially with cats, there are some cats that I'm trying to unblock that are so obese that I feel like their prepuce and preputial area is so tight because
Mhm.
of obesity too. So sometimes it's like a physical thing
Yeah.
that we worry about also. All right. So far we've talked about some of the underlying comorbidities that we can see from obesity, whether or not that's diabetes or respiratory disease, the link with neoplasia, the link with inflammatory disease, and again with urinary tract disease. The last area I wanted to talk to you about is something that I know that we're all pretty aware of with some of the long-term studies that have been done in Labrador retrievers with osteoarthritis and obesity. And that's what we clinically see. I practice in Minnesota, and our number one dog is the golden retriever, the Labrador retriever, and the German short hair pointer for
Mhm.
hunting. And so we see a ton of geriatric, or I don't even say geriatric, 7 to 8 year old Labradors that are obese and have severe osteoarthritis. So again, probably the number one risk we all know about is obesity in dogs, and that link with osteoarthritis. Do you mind discussing the relationship? Is it physically an issue? Is it inflammatory? And then a couple other questions like, are certain breeds more prone to osteoarthritis than others? Obviously, I brought up one of them being the lab. And then the last part of the question is it possible to develop a weight loss program while addressing the nutritional benefits of managing osteoarthritis?
Yeah, so that's a good question. Once again, full disclaimer, I'm an internist. So OA is not my main area, but in general, the way I look at the link between OA and development of that disease syndrome or progression of that disease syndrome, especially in the context of obesity, is you've got the biomechanical side of it, and then you've got the biochemical side of it, right? Or the inflammatory side of it. And I think we're all pretty well familiar with the biomechanical side of it. And I think this really gets into the second part of your question as to why individual dogs or individual breeds seem to be impacted more than others. So, breaking that down a little bit, right? If we think of any sort of joint, and all my orthopedic mentors will be cringing at these descriptions here, but as you have loading, that's actually a good thing for cartilage health, right? Like we were taught that part of nutrition for cartilage is built into that repetitive loading of cartilage, but that's supposed to be under normal force and normal wear patterns, right? And the moment you start to adjust all that physics in a joint is the moment you start increasing the risk of joint damage and then subsequently OA, right? So if all of a sudden I take an animal and add 30% body weight to it, okay, well, now I'm loading that joint a lot more. And suddenly I don't just have this benefit of nourishing the cartilage, I actually have the potential risk of overloading it and damaging it. And then where I think some of the breed angle comes into this is if I now take that and say I have a joint that also has incongruity, or a joint that loads funny, or a joint that has instability, now I'm not only overloading the joint from a weight standpoint, but I'm also misloading it from the standpoint of how that cartilage interaction is occurring. And in people, once again, to keep drawing those parallels, that's why like knee replacement outcomes or knee OA outcomes are so tightly linked to obesity and whatnot. But the other thing that I find really interesting on the human side is actually the fact that obesity is linked to, either carpal or actual like finger OA as well. And like, I think that's so interesting because, well, that's not a loaded joint, right? Like, we're not walking around in handstands as people, yet there's this strong link. And I think that joint has really allowed researchers in that area to explore the component where there's less of that loading issue, less of that joint incongruity issue, but more looking just once again at that link between what's happening in the body and biochemically how that impacts cartilage. And one of the areas that has centered on is really leptin and some adverse effects on cartilage and joint health from that. And once again, if we trace it back, once again, it's this recurrent theme, right? That we get back to white adipose tissue acting as an endocrine organ, creating both an inflammatory and an endocrine dysregulation that has these effects throughout the body. Right. So multifactorial once again, but the nice part for us as veterinarians, from my perspective at least, is the problem is central, right? as a veterinarian, it's much easier, even though it might not feel like it in the exam room, to address obesity as a problem early on. Talk to owners when their animals have a healthy body weight about maintaining that, about obesity avoidance early on in my preventative care, then trying to deal with a multifactorial syndrome like OA after it's formed. Now, to your last part of your question, that it still makes sense though that we don't want to ignore it once it's happened, right? We still want to deal with that obesity and make sure that we're making these animals more lean, more physically fit so that we don't cause progression. And I do believe it's quite capable to create a weight loss program to manage OA, right? And I think the big things that we don't really consider adequately in our day-to-day life is how much we feed our animals and then how much variety there is amongst pet foods and the foods we feed in terms of what we're giving our animals. My two close colleagues that do a lot of obesity research with me are Dr. Winston and Dr. Parker. And Dr. Parker also has an obvious heavy nutrition focus with her specialties. And I remember when I was very early in my career, I went to her and I said, I'm like very, very early on. And I'm like, I don't know, my dog has to have some sort of metabolic problem. He was a German short hair and he was fat. And I was like, how do you make a German short hair fat? Like this, I've accomplished the most difficult accomplishment in the world. And when I actually sat down with her and did a diet history, all the training treats I was giving were creating such a nutrient excess in him that it was like remarkable that he was able to still walk with how many calories I was giving him. But I say that because, I was someone interested in these topics, right? Like my first obesity study was a cat weight loss study that I started over a decade ago. And it still slipped by me, even considering myself fairly well versed in the area. So I think a lot of it is just education and understanding the variables of nutrition. And then the probably most difficult component is owner commitment, right? But managing obesity is quite, to use the word again, manageable, as long as you're willing to take the time and say, okay, what's this dog eating right now? How do I calorically adjust this? Usually starting with RER, 10 to 20% decreases in caloric offering. And then intensive monitoring to make sure that I'm losing body weight at an appropriate rate, not too fast, not too slow, and a lot of communication to update those owners along the way.
Great information. I also did not know GSPs can become overweight.
I had one. I'll
That's
send you the
hard.
pictures. Yeah, he was also like almost all liver. So people used to mistake him for a chocolate lab when he was heavy. And it was the most embarrassing thing in the world.
That's funny.
But wonderful dog otherwise.
That's great. All right. What other problems do you see in overweight dogs? Anything else?
Well, yes, there are. And I think there's also, to kind of belabor the point we've been hitting on, which is obesity seems to affect everything, right? Like it's going to make those back dogs you referenced earlier harder to manage, harder to recover. There's tons of links on the human side that we may or may not actually have on the veterinary side. Hypertension, I think, is one that hasn't been as well established on the veterinary side, but could also be fundamentally linked to obese states and stuff like that. So there's lots of things on the horizon that we should be aware of and understand that even caloric excess in the gastrointestinal tract has effects on the gut ecosystem, and not only inflammation in the gastrointestinal tract, but also on our overall adiposity. So we definitely have this thing where like it is global health. It's a central problem for global health. But the other thing that I often think about, particularly with our reliance upon, let's say, injectable medications, when you get into all of those drugs, right? A sub-Q medication and its absorption and its frequency and those sorts of things are all going to be affected by volume of distribution and how much adiposity is in the animal. And obviously that's drug dependent, but how we handle our drugs, how we prescribe them, probably all needs to be impacted by that to some degree. We're just a little bit primitive so far on how we should be doing that on the veterinary side. But to kind of avoid giving a very specific answer, it's everything. right? Like it's really everything when it comes to overweight and obese dogs in particular.
Great, great points. We oftentimes don't think about that when it comes to fluid therapy, even,
Yeah.
or dosing of medications. Basing it on lean body weight, I think is really, really important. And if I could do vet school all over again, I really would have paid more attention to pharmacology and
Yeah.
dermatology, right? So for all you vet students out there, those are the two important ologies that you must focus on. Great, great information. I'm sure there's so much more information that is still waiting to be revealed when it comes to the health risks and the comorbidities that we can see as a result of obesity. And again, really boils down to us taking the time to appropriately communicate to the pet owners the importance of lean body weight and helping them and giving them resources when it comes to weight loss. Dr. Rudinsky, awesome information. Really appreciate all that you do and so grateful for you being on our Vet Girl podcast today.
Of course, always happy to be here. Thank you.
Thank you so much.